Wear your face mask, help save lives. We're all by now really familiar with that phrase and have surely been complying with this very important guidance to protect our health. But do you know exactly why it's important to do so? Over the next few minutes, we'll share some useful information we hope will make you feel even more confident that this is the right step to take to protect you, your families, and all of us at Atlantic. COVID-19 is highly contagious and is spread predominantly by respiratory droplets generated when an infected person coughs or sneezes. This accounts for how symptomatic or persons with symptoms spread the virus. However, studies estimate that between 10 to 50% of COVID cases are likely asymptomatic or very mildly symptomatic. Persons who are asymptomatic can still spread the disease. This is likely due to aerosols that are generated when the asymptomatic individual breathes, speaks, or shouts. Additionally, symptomatic individuals may actually be most contagious 24 to 48 hours before symptoms appear. That's the pre-symptomatic phase. As a result, barriers such as symptom screening and temperature checks will not work in detecting asymptomatic or pre-symptomatic persons. This is where use of face masks is extremely important. Transmission of COVID is 18 times more likely indoors versus outdoors. That's an important thing to remember. A large study conducted by researchers from the University of Texas, California Institute of Technology, and University of California, San Diego demonstrated that the use of face masks is the most significant means of preventing transmission between us humans. That study showed that use of face covers prevented 78,000 infections in Italy between April 6th to May 9th, and 66,000 infections in New York between April 17th and May 9th. So why is this important to you? The data is showing that use of face masks saves lives. So much so that public health experts are stressing that this is the current vaccine to COVID until the actual vaccine is developed and approved. The WHO, CDC, and Ministry of Health advise that persons should wear cloth face masks when in public. N95 masks and surgical masks should be reserved for medical professionals who are working on the front lines. Many countries, including some states in the US, have implemented legislation mandating the use of face masks in public spaces. Face masks don't necessarily protect the wearer 100%, but it protects persons around you should you have COVID-19. It stops respiratory droplets and aerosols. Wearing a face mask can be viewed as the ultimate sign of respect for your colleagues. Wearing a face mask is society's responsibility to not just protect an individual, but the whole population. Always put on your mask by holding the straps and not the front of the mask itself. Wash your hands after putting it on, taking it off, or touching your mask. Store it in a Ziploc or brown bag in between use. Research has shown that prolonged use of face masks does not result in hypoxia, the medical word for deficiency in the amount of oxygen reaching the tissues. It does not cause low oxygen levels in the blood, nor does it result in diminished cognitive functioning. That means your mental abilities, including thinking, remembering, decision-making, and attention, among others. Medical professionals, including doctors and nurses, wear face masks for periods exceeding 8 hours per day. Those groups have been extensively studied, and there is no data to support claims of hypoxia or diminished cognitive functioning. But always remember, use of a face mask does not mean you don't need to socially distance or wash your hands frequently. So, think of wearing your mask the way Dr. Anthony Fauci recently described it. He said, "It's respect for another person and have that other person respect you. You wear a mask, they wear a mask, you protect each other. Let's protect each other the Atlantic way.